Hello, I'm Mallie Shansfeld, Managing Editor of Orthodontic Practice US, a MedMark publication. Welcome to a live presentation and question and answer with Dr. Alexander Waldman. In our webinar today, we will be exploring how to leverage the fully custom LightForce system to enhance clinical outcomes while differentiating and growing your practice. Before we get started, I'd like to invite viewers to use the question box in your control panel to ask any questions, and your questions will be answered at the end of the session. Also, associated with this presentation is a free CE quiz. At the end of the webinar, we will email all attendees instructions on how to access this CE quiz. I'm pleased to introduce our guest for today, Dr. Alexander Waldman. Dr. Waldman is a diplomate of the American Board of Orthodontics and a triple Ivy League trained orthodontist. He received his undergraduate and dental degrees from the University of Pennsylvania and completed his fellowship in orthodontics at Harvard University. Dr. Waldman's private practice in Beverly Hills is recognized as one of the leading orthodontic practices in the United States, as he treats a wide range of children and adults and is an expert in all types of braces and Invisalign. Dr. Waldman blends the latest research and technology with traditional evidence-based orthodontic techniques to provide patients with cutting-edge orthodontic treatment. He has fully embraced digital technology to bring his patients more comfortable and accurate treatment options. Dr. Waldman, we turn the webinar over to you to learn more about our topic for today.
Thank you so much, Molly. And I wanted to just thank, to start out, all of the people at OrthoPractice US, as well as LightForce. There's too many to call out by name. You know who you are. And thank you so much for putting this together here for us today. I wanted to welcome all of the attendees. Thank you for taking time out of your busy clinical schedule to come and learn a bit about the digital playbook with LightForce, which is our topic for today. We are live, so we're across a number of time zones, probably anywhere from Hawaii to the East Coast and perhaps beyond. So once again, thank you for joining, and I hope to make your time today worthwhile. So our topic is the LightForce Orthodontics digital playbook. And really, to talk about digital orthodontics, we need to take somewhat of a trip down a memory lane to about 20 years ago, when aligner therapy created essentially the digital playbook and created a digital flow of orthodontic treatment. Scanning teeth, which originally, of course, was an impression which was scanned, and now we have direct scanning, digital treatment planning, and customization of the appliance through 3D printing and manufacturing, easy delivery of an appliance, digital monitoring, which has come about more recently, and of course, all leading to a highly customized digital workflow. And when we look beyond just the facts of that we have a scanner, that we have a digital treatment plan, we have to think to ourselves more globally, what has really changed in our practices and in our kind of our lives as a result? And the answer is that we've been able to achieve in a certain scope or a certain sector of orthodontics, within at least aligner therapy, mass customization. And patients don't realize this. They kind of get distracted by the fact that aligners are clear and they're comfortable and they're easy and great. But as orthodontists, I think what we've learned to appreciate is that they also work quite well when we know what we're doing with them. And it gives us a tool to provide a customized appliance and a customized solution, which is so valuable to carrying out a clearly defined treatment plan and set of treatment goals. Of course, what's changed the result is that aligner therapy has opened up growth in new population segments, like adults. It's relevant for today's digital consumer. People have different values these days. The world has changed a lot in the last 20 years since I started in orthodontics 20 years ago. And we need to be relevant so that we can continue to provide excellent results and distinguish ourselves as specialists. Patients are excited and engaged about doing orthodontic treatment because of the high level of treatment that we can offer with regard to customization, aesthetics, etc. And of course, as doctors, we appreciate the clinical efficiency, which we may not have seen in the early days of the digital playbook with aligners. But I think that many orthodontists that I speak to over the last few years, and I speak for my own practice as well, have been able to achieve very high levels of clinical efficiency with aligner care, despite the fact that we're using a removable appliance and we still have the issue of compliance. And at the end of the day, we've discovered that practice can be enjoyable because we have fewer emergencies, we can have more time to engage with our patients in conversation and not fixing brackets or repositioning brackets, etc. And so it's made our practices fun places to be. And at the end of the day, we spend a lot of time in our office and we want our practice to be enjoyable. So really, we started with this playbook of all these different steps that you need to engage with this level of care. But it's given us many gifts in our practice and given many gifts to the orthodontic industry as a whole. Of course, there are challenges, and there's many challenges now in the marketplace. Aligner therapy has now spread into the direct-to-consumer market, and we're all challenged by that in different ways. But the fundamental technology, I would say, for the most part, has been very positive. And for us, we've been, in our practice, we've been thinking about this concept of the digital workflow versus the digital mindset. You might hear these two terms bantered around, and what are they really? Well, the way we like to define it is that the digital workflow are the things. It's the things we have. So we have a scanner, we scan teeth, we have a digital treatment plan, that's another thing. We have a aligner, we have an attachment template, it's a thing. You know, we have maybe a dental monitoring scan box, it's a thing. But when you add those elements together and then you eke out the efficiencies that come out of that system, you now have the digital mindset that you need to change the way you practice. So the things become concepts, they become ideas for growth and for change. And some of the areas that we've seen this digital mindset change our practice is in the area of scheduling, where we've seen that in particular with the history of the digital workflow to date, and we'll talk about the future in the rest of this lecture. But to date, we've seen the changes that we've brought with the standard aligner digital workflow have changed our scheduling, seeing patients less frequently, but being more productive with those visits, and being more productive in the office. Higher degrees of profitability, specifically with regard to the amount of fee that we kind of apply per visit. Because if we can maybe complete an aligner treatment, sometimes even fairly complex cases, in 4 or 5 or 6 visits, and sometimes even less than that, obviously we're going to enjoy a much higher degree of profitability than if it takes us 25 visits with analog braces. And then, of course, the final outcome of this digital workflow is that it allows us to change our mindset and to change our lifestyle, that the doctor will have more time to think, to plan, to grow the practice, to interact with colleagues, to teach, to learn, etc. The orthodontic team will have time to reflect on what they do, to spend time on patient care, on follow-ups, and not be running around with like a chicken without their heads on all day, just fixing broken brackets and tying in wires. And then, of course, to the patient, there's a huge improvement in the quality of a patient's life when we're able to provide high-quality digital workflow treatment results in a reasonable amount of time and with fewer appointments. So there's a huge qualitative and quantitative difference that we see in our practices when we embrace the digital workflow. In summary, the digital workflow is a good thing, and it might be expensive to buy all those things and the components, but once we get them and we have them, it opens up huge opportunities. And in about 2019, that's really the feeling that I had about aligner care in our office. We felt that we had achieved a high level of efficiency, profitability. We were really happy with how this was all turning out. I can't say it was easy, and we struggled along the way to come up with those systems that allowed us to be productive and efficient with the digital workflow. But once we got there and we saw the fruits of our labor and how much we were enjoying it and how much it benefited us and the patients, it became such a no-brainer. And at the same time, created this huge tension and this huge source of frustration, because the whole other side of our practice, because we were at the time still 50% fixed appliances, still 50% braces. This whole other part of our lives was so analog and so undigital that we didn't have any digital workflow really, other than maybe printing some study models or working models from our 3D printer, but we didn't really have any digital workflow that could capture the same elegance, the same level of planning and efficiencies that we had with aligners. And it really started to get frustrating. And on a numerical basis, because we like to look at the numbers of our efficiency, our profitability, and we start to look at the number of visits it would take to complete an aligner case versus the number of visits to complete a standard analog braces case, it was staggering. And we look at the profitability per visit was absolutely staggering. So it really dawned on us that we needed to do something different to raise our game with our braces to the level of our digital workflow with aligners, so that somehow, some way, and we didn't know how, we could achieve a full digital workflow in our office and carry over the benefits from aligner therapy and all the things that we learned along the way to our fixed appliances. But we didn't have the path forward. I, at the time, thought that maybe it was through digital indirect bonding. I was doing manual direct bonding, and we felt we always had pretty good bracket position as a result. But even with like really perfect bracket position, there were still so many issues and so much manual labor needed to complete a fixed appliance case, because of course we realized that, you know, it's not a custom appliance. And it just became so ludicrous that we were using in every patient, whether they were an open bite or a deep bite, a class 2 or class 3, you know, et cetera, et cetera, et cetera. Just think of every kind of polar opposite, you know, diagnostic factor that you can put in. We were taking all of those and using the same set of braces with the same prescription in it, and not even really fully planning out what we wanted as the endpoint for the teeth. And when we compared that analog generic experience with the customization and the thoughtfulness of the treatment planning with our aligners, it just became really too much to handle. We realized we needed a solution. So in 2019, the AAO was hosted here in Los Angeles, and of course I practice here in the Los Angeles area. So I took myself and my staff, and we headed out downtown to the LA Convention Center, and I really had one goal in mind. You know, when we go to these meetings, we often have like little projects, things that we want to look into, see, learn, buy, etc. And I was committed to coming out of the meeting with a digital IDB solution. Lo and behold, to make a long story short, I discovered LightForce and really found a solution that was, I guess, you know, to borrow a pun, you know, really like light years ahead of standard brackets. And it's changed our lives since then in our practice, and has allowed us finally to achieve a full digital workflow. So that's kind of my story. That's where we've been. We've seen such a tremendous improvement in our practice in the last year and a half or so, since about June 2019, when we bonded our first LightForce case. And so today I want to share you a little bit of how we think about it, what we've learned along the way, and at the end we'll also share some cases just to show you a little bit about what we're doing here in the clinic with LightForce. So this begs the question, you know, what is LightForce? And I'd like to throw out 3 definitions here. The first one is LightForce, in its most general form, is a platform for customization in orthodontics through 3D printing. In another light, it's looked at as the most advanced digital solution for braces on the market today. And thirdly, and I think practically in terms of our topic today of using a digital workflow to enhance our practices in all regards, it's a technology that will allow you to transform your practice to a full digital workflow. Now that could be, if you're already doing quite a bit of aligner therapy in your practice, that will allow you to complete the cycle and get you to fully digital. If you are a practice that's doing braces and obviously analog, standard non-customized braces, you will now have the ability to take that and to completely transform it into a digital experience that will totally change the way you think about your braces patients. So there's a LightForce bracket, and the question I want to ask is, why now? Why is this becoming a thing right now? And the answers are somewhat obvious, but I think it's useful to go through them. The first point is that there have been advances in 3D printing. And LightForce, as we said, is customization of the appliance through technology, through software, but ultimately it allows us to mass customize. And that was really the innovation of aligners that we had back to kind of TP orthodontics back many years ago. We had the idea of moving teeth with aligners, but we didn't have the technology to mass produce or create large movements, controlled movements, before we had 3D printing. And we're able to 3D print those models in sequence. The idea of customization of an orthodontic fixed appliance goes back to the founders of orthodontics. If you read the early papers by Engel and his cohort, you will see that customization was always the end point, but there was never the technical ability to do so. Even into the 70s and the 80s, when straight wire became popularized, it was still recognized that it was falling short of the true goal, which would be to have a customized appliance for every single patient. That we have a set of braces that are made for the patient, that fit the patient perfectly, that are designed to achieve the specific goals that we are seeking to achieve with that patient. It was always the goal. It was technology that held us back. And it's 3D printing that really allows us to now scale up this concept for every single patient. You design, you print, and you deliver. But I think it's more than that. It's not just having the technology. It's kind of this inflection point, like I just described to you, that many doctors are feeling very frustrated with their fixed appliances, to a certain extent, comparing it to their aligner cases now, and the elegance of that digital workflow that they feel they're missing. The straight wire appliance has been basically static for nearly 40 years. Think back, I've been in orthodontics for 20 years now. And the braces that I've been using are essentially the exact same ones that I trained on 20 years ago. Nothing's changed. And that is astounding when you think about it, all the technological change that's happened in our world, except for the main thing that we do every day. We're experiencing lengthy treatment times, and in fact, our aligner cases started to finish in less time, and I know that many doctors have told me this, in less time than their fixed appliance patients. Like, how is this even possible when you think about it from a kind of orthodontic point of view? This is a fixed appliance. It's on the tooth 24/7. There's no compliance issue. How is it not delivering a result in a shorter amount of time? And there's many answers to that. But obviously, one of them is the lack of customization. If you put a generic appliance that is not intended for the patient on them, how could you actually expect it to get to your goals when in many times it's actually fighting your goals? And there's so many inaccuracies in the placement, so much human error, and so much extensive detailing needed to essentially take this generic appliance and customize it for your patients, right? That's what you're essentially doing in the process of repositioning brackets and detailing. You're taking this fundamentally analog, uncustomized appliance and trying to customize it, but you're using your mind and your hands. And not to say that a computer is better than your minds and your hands, But there are some things that computers do better. And in this case, the ability to digitally produce a custom appliance is something I think that is worth embracing and accepting, in our lives with a dose of humility that perhaps, there's something better than what we can do with our hands. And of course, it all comes back to the lack of the digital workflow. On the flip side of like where doctors are in this cycle, I think patients are also really ready to accept something new. And patients are much more aware of digital technology, healthcare innovation. They're much more in need of efficiency now due to their lifestyle constraints. And patients are ready for something better as well. So there's this kind of like tripartite approach that's been building: technology, need coming from the doctor and her or his experience with the appliance, as well as where patients are. But then, of course, the final kind of nail in the coffin, I would say, for analog appliances is that the world has changed. And the world has changed very dramatically up until last night with the news that our very own president has contracted the coronavirus and is beginning to show some symptoms of COVID-19. And we've all gone through a lot over the last 6 months. I can't believe it's almost 7 months now. And unfortunately, some of us have either ourselves or family members have gone through terrible illness, pain, suffering, and this has changed. This has changed our culture. It's changed the way we do business. It's changed a lot. And I would say in our very small world of orthodontics, I want to embrace kind of an economic model to explain what I'm kind of seeing in my practice. And as I speak to other doctors now around the country, what I'm seeing happen in many different geographic areas, that despite all the pain and suffering that's going on out there, there's actually quite a bit of demand from the patient side. And for those patients who have been fortunate enough to hold on to their jobs and to maintain some economic security in these times, we're seeing that they're spending a lot less money. And therefore they have access to more disposable income. There's just less things to spend money on these days. You can't go to the movies. It's harder to go out to eat. You're not going shopping as much. You're not traveling probably. So suddenly you have the money to invest on things that are important to you and your family. Patients are at home and they're suddenly like willing to wear ortho appliances. I've had more adult patients say to me in the last few months than ever, hey, I wouldn't mind wearing braces because I'm wearing a mask all the time anyway. And there's a lot of awareness of the need for orthodontics, which is being driven by the fact that we're spending a lot of time, right here in front of our screens. And people are on social media and they're on Zoom and starting to notice things in their facial appearance that they may not have seen before. Of course, we have a lot of direct-to-consumer marketing that is, take it or leave it. And obviously, there's a lot of issues with that now in our industry. But the one thing we can say for it is that it is driving a lot of market awareness. And it's tapping into this abundant marketplace, that discovering that there are a lot of people who do want orthodontic treatment. I think the take-home message there is that people want aligners, they want digital treatment, they want things that are efficient, that get great results in a reasonable amount of time. They do not necessarily want metal analog braces. This is not tapping in. That's not part of the abundant marketplace. Now, the flip side of it is what's happening on the supply side for doctors, that unfortunately we are seeing a reduction in the workforce as many staff members don't feel comfortable coming back to the office if they may have small children at home or parents or grandparents to take care of that might be more susceptible to the virus. We're seeing a need for reduced patient flow to maintain safety, less columns, less patients per day. So we have this demand, but we're not actually able to keep up as easily as we've been able to in the past. Because of that, we need to control costs, and we need to keep a low inventory. We need to reduce the number of appointments in any given patient's treatment so that we can reduce their exposure to the medical building, to the office, and help to reduce, to do our part as doctors to help to reduce the COVID spread and the risk in the community. The big word these days is to pivot. And I think that at the end of the day, what this means is that we do need to pivot. And we need to pivot as a profession so that our core services, which are braces, kind of to a certain extent, I think I forget the numbers, but the last time I checked, the majority, despite the growth in aligners every year, the majority of patients in this country are still being treated with braces. So that's our core business. And because of what's happening out there, I don't think we can really afford anymore to be inefficient. We can't afford to save a few bucks to buy a cheap set of braces, knowing that we have lots of staff and lots of chairs and all of that. We have an abundance of resources in our office, and that we can afford to buy a cheaper appliance that's less custom because we have plenty of time to treat the patients. And so what if it takes 20, 30 visits? It's okay, I have the staff. Well, that's changing, and we do need to pivot and think about more operating in a more limited environment, whether that's now or perhaps in the future. In short, we need a new solution for braces. And LightForce is that solution. It is one of those solutions, of course. And it is an incredible digital solution that really has three intertwining areas of the clinical benefits, the operational benefits, and the business benefits. So I'd like to walk through, at least from our perspective over the last about year and a half of using LightForce, what we feel those benefits are. So on a clinical level, we've discussed already the benefit of using a 100% custom prescription and custom bracket. It's kind of hard to describe the difference of using that until you start using it. And once you start using something like LightForce, which is 100% customized, created for that patient, you have an end goal in mind. It actually starts to make your other braces, which of course we still have in our practice, kind of finishing up older cases, that it kind of makes it just seem so antiquated, that we somehow thought that placing these generic, one size fits all, kind of brackets, that somehow would get the patient to where we wanted them to be in a reasonable amount of time. It's kind of challenging to the mind. And of course, LightForce also brings precise bracket placement. We'll talk about indirect bonding in a few minutes. And board quality results. Of course, whether we're board certified or not board certified, we're all trying to get that high quality result. And it's very hard to do when you're manually placing brackets, or even if you take the next step up and you're manually direct bonding, or even if you take the step up from there and you're digital indirect bonding, when you're using an analog appliance that doesn't correlate, that one tooth doesn't correlate to the next. Each bracket placement is somewhat independent, and I know this because I did it for years with indirect bonding like this, that it is really hard to achieve the board quality result that you're looking for. With LightForce, we see such beautiful arrangement of the dentition in terms of marginal ridges and alignment so early on in the case. It really gives us the confidence that we'll be able to achieve a board quality result in the majority of our cases. Of course, one of the huge things about LightForce is that despite the fact that this is digital, it's not removable, it's fixed, it's braces. So we don't have to rely on patient compliance. It's a huge clinical advantage. And the other thing is that, a lot of the newer systems out there that are digital are very hard to adapt to. You have to learn how to think about a whole different type of wire. You have to maybe do things on lingual. There's just complicated things that take a long time to ramp up, that are not intuitive. And the beautiful thing about LightForce is that it's a labial bracket. You got this. We know how to do it. It's a very small learning curve for the doctor and the staff. There's no complex wires. You use your regular wires, and there's no special mechanics. All you have is a braces system that you put on the teeth accurately, and it works, and it gets the teeth where you want them to go. I was talking to a colleague of mine the other day, and I kind of used the analogy. It's like if you'd be able to take a set of aligners and just glue them in, right? That would work really well. I always like to talk about my friend and colleague Drew Ferris from Santa Barbara, who shows an incredible case in one of his lectures of a very difficult aligner case, but such a beautiful result, because the patient, unfortunately, due to medical reasons, could not take out their aligners, or didn't have to take out their aligners because she didn't eat through her mouth. And the incredible results you would see if you actually just kept your aligners in, right? So this would be like if you had the perfect combination of having a fixed appliance on every patient, but also have the digital and custom planning. It's a very powerful combination. Okay, obviously, any clinical, there's a lot of techniques coming at us these days, and we get the emails and all the product updates and reports. But at the end of the day, we are small business owners, and any new product has to be financially sound to be successful in our practices. And I think that LightForce is extremely sound for us, because it gives us, first of all, that we have a differentiated appliance that we can be proud of and say that we offer every patient a full line of customized appliances, because custom is better in orthodontics. We have something now that's attractive to Gen Z and to millennials. They understand 3D printing, they understand the technology, and they really love the concept that this is an appliance that was made custom for them. From kind of a more fundamental business perspective, with LightForce, you don't pay if you have a loose bracket, a patient bites down on a piece of ice, knocks off their bracket. You're not paying to reorder. It's one patient, one price. When you pay for that set of LightForce braces, you are getting whatever you need to complete that case. However many replacements, whatever you need, you're getting it for that one price. And I think for me, fundamentally, the concept of eliminating inventory. Yesterday I had a situation where I had to band a second molar, and I hadn't banded a tooth, honestly, like in a while. We do so much bonding, and even like the cases that we use banded appliances for, like expanders, generally we're sending the lab the scan, so they're fitting the bands in the lab. So we don't do a lot of banding these days. But I happen to have a band box out in front of me. I was just astounded by how many bands were in this box. So I asked my assistant to count. And there's one band box, and we have 12 band boxes for first molars, second molars, primary teeth, etc. In this one band box, there were 225 bands. It was fully stocked. And we estimated that that was about $2,000 in inventory, meaning that in my 12 band boxes that were sitting there, I probably had somewhere between $20,000 and $25,000 of stock, literally just sitting there. I was petrified to even look what we had in terms of old braces inventory. And inventory is expensive, and particularly in times when we need to watch our, kind of pennies a bit more. And so, I think that the beautiful thing of just being able to order what we need per patient is really significant. And although, of course, LightForce digital braces will be more expensive than a standard set of brackets, because you're getting so much more. You're getting the indirect bonding trays, you're getting all the technology. It is still very, significantly less than a set of aligners. And so we're still going to have a significant amount of profitability. The other way to think about a profitability with LightForce braces is that there's going to be a much higher profit per visit, because it takes less visits and less time to treat the case because of the customization. And so, this again may not be important to a doctor when they have a big office and lots of staff and lots of chairs, and it's just easy to schedule someone, and it's not a big deal if it takes a bit longer or more appointments to finish a case. But when you're at capacity, whether it's you choose to be at capacity or you're forced to be at capacity because of something like coronavirus, suddenly there is a tremendous amount of value in being able to treat the patient in a reasonable amount of time. And finally, from an operations point of view, this is something that's scalable from a small, boutique practice that wants to offer the high-end orthodontic treatment to a large practice that wants to take advantage. They have so many braces patients, and they want to take advantage of the ease of the indirect bonding and the efficiency of the treatment. And really, at the end of the day, from an operational point of view, allows us to have a full digital custom practice, which for us means the following. We now have the same workflow for everything. Before it was different. If you're in a liner case, it's this kind of sequence. If you're a braces case, it's this. Now, every patient is the same. We scan, we do the digital planning, they're scheduled for a delivery 4 weeks later, and we begin to treat and we begin to monitor. And we have, like we said, fewer and faster appointments, shorter treatment times, and lots of opportunities to delegate. So let's get a little bit more into the detail of what is this workflow and how does it go, and what are the advantages of the specific components of the LightForce digital workflow. So we start with records, like in any kind of a digital workflow, and head into treatment planning, production, application of the appliance, indirect bonding, and finally to the treatment. And like we said, same workflow as clear aligner therapy. So very easy for the staff, very easy for the doctor. It all becomes one digital practice. When we present a LightForce treatment plan in consult, one of the questions that I often get from patients, is like very often, is why would anyone not do this? Why would any patient not choose to have a customized appliance? Because patients kind of intuitively grasp the concept of customization. When you explain to them that the only reason that we used a generic appliance was not because it was good or the right thing to do, but it was just the best approximation of what our treatment goals are, and technology wouldn't allow us to actually efficiently and cost effectively create a custom appliance, but now with 3D printing, we can do it. They get that. And we have found that it's a significant practice differentiator that they want to go with this because it's not being offered in many other places. And custom seems to communicate value. Patients understand the value of custom, just like they understand that a custom suit is better than an off-the-rack suit. Custom does communicate value. And also just the fact that what we're doing in that room, right? The fact that we're scanning their teeth and showing them an example of the software, it really does send a message that this is different. This is not your parents' braces, right? This is not what you're used to. This is different and it's better. Once we have the case submitted, within a certain amount of time, we get back the light plan. And the light plan is kind of like the analogous software to Align Technologies Clin. It's a cloud-based software, very familiar interface with the ability to edit and move the teeth and send messages back and forth with your technician. The one major difference we're seeing with LightForce compared to other companies we've worked with is that the setups are excellent. When we get the setup back, there's very, very little tweaking that you need to do. Maybe a few little things here, maybe a little overcorrection that you want to put in, maybe some minor incisal edge movements, but basically the case is 95% set when you get it back from the lab. And these days, I actually have done a few this week. I would say probably 4 out of 5 that I did this week, I accepted in my first evaluation, and I think we did maybe one edit on the second one, which is a bit more of a complex case. And of course, this is all editable per your preferences, and you can use little dongles to be able to control these movements manually, or you can do it or you can do it with instructions to your technician, whatever is more comfortable for you. People ask me, are you moving the brackets or are you moving the teeth? So you're actually moving the teeth. And although this is not a lecture in how we do the light plan, basically you see the final version of the teeth aligned, and then you're going to tweak that final position, how you want it to be. And then the brackets digitally adjust themselves to be able to deliver that movement to the tooth. There's a lot of features. There's superimposition. You can look at the IPR, your occlusal contacts. There's a really interesting kind of animation that you can see how the movements will occur between the initial and final stages. We'll get back to that later in the cases. And of course, looking at the compare the initial final view, an arch wire can be placed in there, so you'll see the actual deflection of the arch wire, and we'll see that later. And of course, most of the other tools that you would expect from any digital system. Okay, and now talking about production. And but before we do actually that, let me just make a few more notes about this concept of treatment planning braces. We're used to kind of thinking about a treatment plan for braces as like, is this extraction or non-extraction? Do I need a carrier first or not? Do I need an expander first or not? But we don't really think too much about the appliance itself. We've been kind of dumbing it down. And maybe some of us are better at putting on braces than others. Maybe some of us do indirect bonding. But at the end of the day, we don't have really, I think, as a profession, the full trust that the appliance itself is going to get us there. Because we know at the end of the day that there is information in that appliance that might not only be helping us, but might be hurting us. We may want to apply, in a case, positive torque on a canine, but our prescription has negative torque or zero torque, So we know at the end of the day that it's almost kind of futile to think through the actual effect of the braces too much, because we're going to have to tweak that with the wires. We're going to have to tweak that with elastics, mechanics, right? But when you have the ability to actually think through how the braces can and should get you to your desired outcome, it really leads, at least it's led for us, I think, to a renaissance of treatment planning for fixed appliances. We're thinking about moving teeth, not the brackets. And that allows us to create this custom alignment with every tooth in every dimension. And a lot of people have pointed out to me that sometimes they feel their results with their aligner cases look more natural and look better than their braces cases. Like, why is that? I think the short answer is that in your aligner cases, you put in the movements you want, but you don't have like random like torque built in that you didn't plan or don't want. Whatever's in there is in there. You get it or you don't based on the compliance, based on maybe how well you kind of put those movements in there. But you get what you want and you don't get what you don't want to a certain extent. But with braces, we have this whole like system in there with all this pre-programmed torque, and we have a lot of things that are fighting us. When we stop fighting our appliance and our appliance supports us and supports our goals, we can really visualize what we want to have happen in a case. And we'll see that in some of the case presentations. The fact that we're doing digital treatment planning allows us to really think through things that we just never could before, like a smile arc. That's become a very popular way to place brackets, place the maxillary anterior brackets a little more gingivally, get that nicer display. We love that concept. But it's actually very hard to do with a standard appliance, because when you change the position of the bracket, you change the torque with a standard bracket. With LightForce, when you change the position of the tooth, you don't necessarily change the position of the torque unless you want it to be. And that's where the digital planning comes in. Again, we discussed this. We are able to define our goals, and we're not limited by a generic prescription that was decided upon 20, 30 years ago. And I find actually just having the digital tool of the Light Plan an incredible communication tool with dentists and specialists and with patients. We've been able to, over the last 20 years, share our goals with our aligner cases with referring doctors, patients. How many times has a patient said, "Can you send me the plan?" Or a dentist wanting the plan. But we've never really been able to do that with braces. We have to kind of describe it with our hands or show them maybe an example. The ability to do this is extremely valuable, both in consult and also chairside. And one of the things about this you know, the digital planning, that was somewhat of a surprise to me, is how powerful a true custom base that we can achieve with LightForce, how powerful of a concept that is when we can get true anatomical adaptation to a tooth. It really kind of wipes away some of our fundamental assumptions about how brackets need to be placed, and we'll get back to this. I want to just take, there's many examples of the digital planning. This is just one really cool one that was shared with me by Dr. Griffin, showing us that, you know, we're kind of not used to thinking when we place brackets about how the bracket plane is going to affect the, you know, position of the teeth and the amount of torque expressed and the leveling of the arch. We just kind of like, I don't know, maybe hope it works out, or just assume that if we put our brackets on right, that's all going to work out. But we know often that's not the case. And I think what's really amazing with the LightForce software is that we're able to visualize that plane. And no matter where we move that plane, the brackets are going to adjust. So if there's a reason why you want to place your arch plane or your bracket plane, your wire plane more gingivally, maybe to avoid occlusal contact, you can do that simultaneously without affecting any torque. The program will maintain the amount of torque that you decided upon based on the position of the teeth. And if you let that concept sink in, it's really, really powerful. And this is something that you know, you kind of can't quite understand it until you start doing it and start realizing what you were missing when you were only thinking about individual placement of analog brackets and not kind of whole arch thinking with custom brackets. What's been a tremendous kind of insight has been how accurate the digital planning actually turns into reality. If you take a look on the left of the screen, you see this digitally planned bracket and how it just contours that bicuspid perfectly. You take a look how that's, you know, bonded in the mouth and how perfect that is. You really see the power of the accuracy of 3D printing. And this kind of true labial custom base is, for me, as the biggest standout is that it solves the second order issue. Most of my time, I felt it was taken in terms of finishing cases, was taken up with detailing second order bends. And that's of course because the analog brackets don't have any accommodation for what these teeth actually look like in real life. Some people have skinny teeth, thicker teeth, you know, there's all different variations. And essentially what we're doing with our second order bends is accommodating the fixed appliance to the anatomy, but using the wire. With LightForce, because of the digital planning, that's all built into the thickness of the bracket. And each bracket can be a different thickness, a different rotation, but at the end of the day, will allow you to have a true straight wire in your finish. And that's essentially what we're seeing in the, I think, 75 or 80 cases that we're currently treating. There's basically very little to no need for wire bending. And just that saves huge swaths of time in treatment. Obviously, this accounts also for all those teeth that are just, you know, those funny shaped teeth where the brackets just don't fit on the teeth properly. I'm talking about an analog bracket. It doesn't fit on the tooth and it rocks and you have to kind of rebond it to compensate for that. The LightForce bracket has all of that built into it with an intimate and high bond strength, of course. And it just really changes how we think about bracket placement. Because we stop thinking so much about bracket placement with LightForce. We think about where we want the tooth to be and what we want the outcome to look like, and then let the technology work for us and create a bracket that will get us there in a true straight wire approach. All right, now let's pivot to the production. I won't spend too much time on this, but I really want to talk about, you know, what's the outcome of the production? I don't understand all the intricate aspects of, you know, 3D printing, other than that it works. But for me, I want to know the practical outcome as a doctor. What is that giving me? What are the advantages of this? What are the advantages of the 3D printing process? And I think that on the most practical level, other than obviously the obvious things, the ability to customize the base, the ability to customize which brackets get hooks and don't get hooks, because we're just printing it. It's really whatever you want. But at the end of the day, it's the parallel slot. 3D printing, for those of you who have 3D printers in your office, you know that 3D printing is not as good as as good at printing round surfaces as it is straight surfaces. Now, luckily, our slot is straight; it has parallel walls. And LightForce, it's been shown through internal studies, has the most consistently parallel slot in the industry. Why is that important? Because you can design the most interesting digital bracket in the world. You can put all this, digital planning in, but if the bracket isn't actually going to get you the movement you intend, it's all for naught. And in order to have that intention, you have to have an accurate slot. A word on slot, by the way, you can do any slot size, 018, 022, or 020. We're actually partial to the 020. That's been a very unique slot. It's kind of a lecture in itself, but we're really, loving our 020 slot. I think the take-home message is every case can be different, so you don't have to be married because you don't carry inventory. Every case can be different. You don't have to have you don't have to be 022 or 018. Maybe you'll decide based on an individual patient or a group of patient, like my extraction versus my non-extraction, my surgical versus my non-surgical, that you want to be an 018 for one group and 022 for another. There's lots of creative things you can do with this feature. But here's, I think, where the rubber hits the road. And this is another slide that Dr. Griffin was very generous to share with me, that when we take a look at slot play, we all know that there's play in our slots, but I think we forget how significant that is. If we take a look at the bottom right, a 1925 steel and an 022 slot, the typical range of play is 19 degrees to 35 degrees, meaning the amount of play sometimes outweighs the amount of correction. So it's kind of like a net zero, actually, when you think about it. In LightForce, it's 11 degrees with a very small standard deviation. And on the flip side of it, in the 018 slot, we have a 4 to 15 degree variation, and LightForce is coming in at just under 4. So you can see that it does make a difference, and having less play does imply more accurate treatment. Okay, now let's kind of pivot forward here to the more practical aspect of treatment, getting into the indirect bonding. I've been using indirect bonding solely for all my cases for about 10 years. So we've done thousands of bondings over these years with indirect bonding. And I can tell you that in comparison, the LightForce indirect bonding solution is truly best in class, both in terms of the ease, the accuracy, just really everything about it. And for those doctors who are listening to this who are new to IDB, who are interested in doing indirect bonding but have not yet done it, it really will provide a very easy transition for you and your staff. For those of you who are doing indirect bonding through any other lab method or doing it yourself in your own lab, I think you will find that it is a night and day experience for both your staff and for yourself. And what's really happened in our office is that it's allowed us to create this 100% delegatable start visit. Of course, I still go over to the chair, I still check things, I still speak to the patients, but I do not really need to be involved on a clinical level because the IDB is so accurate. And we've already usually selected the wires based on the light plan. We had referenced before the fact that in the light plan, you can see the deflection of the wires. If you take a look at the deflection of the wire in the upper left image, and then compare it to the day of bonding on the upper right image, you'll see how close the actual digital projection of the wire matches what we expect to see in the mouth and what we do see in the mouth. Meaning that as a doctor, when you're doing your light planning, you can actually call out the wires ahead of time, have it in the chart, and the assistants will not only be able to do the IDB, but be able to place the wires that you called out. And last but not least, I always used to have to be called over to the chair to do the bite opening, how much, on which teeth, etc. One of the unique features of LightForce is that you can program digitally biturbos, and then you receive a tray that you can do indirect bonding of your biturbos, which have been digitally programmed to open up the bite to the exact perfect amount. And the fact that that can be, delegated in addition to the wires, in addition to the brackets, truly makes, I think, LightForce the most delegatable bonding system currently on the market. Okay, when we get to the treatment, obviously this is where the rubber hits the road, as we said. Our experience so far is that we're seeing fewer appointments, and we're seeing that the treatment is very much analogous to aligners, that we're using longer intervals due to the programmed nature of the appliance. We're seeing shorter treatment times, again, due to the programmed nature of the appliance. The appliance is not working against us, it's working for us. And we also are starting with incredibly accurate bracket placement, a prearranged arch wire plane, and everything custom in all of the dimensions. And it essentially, if you think about it, using LightForce, as we previously discussed and showed the custom base, really eliminates some of the traditional stages of orthodontic treatment that take a lot of time, such as repositioning brackets or detailing the wire. And if you designed your light plan correctly, for the most part, you are eliminating the need to do this, and it saves months and months of treatment. Another thing that we're seeing that helps to shorten the treatment times is that we want to proactively engage our third order wires earlier in treatment due to the confidence in the prescription. It's not like we're trying to hold back. Maybe there'll be some side effects from engaging, a rectangular wire too early. Whatever's in the prescription is something that we want, and so we want to engage that early on. That also allows us to start elastics earlier, and so we're just getting more involved in the treatment at an earlier stage and really changing how we think about how treatment progresses. And of course, the proof is in the pudding. We're seeing excellent results that are very true to plan. So let's take a look at just a few slides that talk about the clinical management of LightForce cases and a few case presentations. And I'm going to try to go through these quickly in the next 10 minutes or so that we can have time for questions as well. So let's first talk about wire recommendations. So first of all, we do not need special wires when we use LightForce. No custom wires are needed. You're going to use your preferred wires because this is truly a straight wire system. And basically, by using a straight wire, you're going to activate the custom RX in the bracket and not need to have any special wires with fancy bends in them. One of the things we've learned by treating LightForce cases is that we definitely want to reduce the number of wires per case. It allows us to reduce the number of wires per case because we allow each wire to work for longer due to the trust we have in the appliance system. For non-extraction cases, we pretty much have it down to 3 wires. We start with a round nai tie. We transition early on to a square or a small rectangular nai tie, and then we finish in a large rectangular nai tie. Of course, you might need to use a stainless steel or a TMA as needed for placing reverse curve in the wire. Maybe you have a little finishing bend you need, but that should be fairly limited actually. And kind of the goal about thinking about wires is that you want to get into your third order wires early in treatment, as we said. Remember, we want to fill the slot. We want to express the very accurate prescription that's in it. From a scheduling point of view, as I said before, we're going to increase the interval between visits. We're just thinking about less reties and really more activity at each appointment, whether it's a wire change and activation of some sort. We just find ourselves being much more proactive, knowing that we want to move along in that treatment and get as much activation out of the appliance as possible at every stage. This is a pro tip for those of you who use dental monitoring or considering using it. This is something that we've actually used in our practice for a few years, started with aligners and then kind of moved over to braces when we started using LightForce. And we find that it actually is a tremendously complementary technology because during those longer intervals between visits, we still, of course, want to observe the patients, make sure the wires are staying tied in, make sure the hygiene is good, make sure there's nothing broken or poking. And that allows us to have confidence that we're letting our appliance do its thing, but we're also ensuring that patient safety is there throughout the entire experience. Okay, so at the end of the day, what have we learned from the last year and a half? We've learned that many cases will be completed within 12 months and some significantly faster. As I said before, fewer visits. We're seeing rapid and efficient leveling and aligning. And cases are often completed by the first adjustment. The cases are often completely aligned by the first adjustment. The digital plan is indeed accurate, and what you see on the digital plan is basically what you're going to get in your case. In terms of occlusion, we're seeing excellent inter-arch coordination, and I'll show this in the cases. And we believe this is stemming from the digital planning of the wire plane. You know, we're not used to kind of thinking about, when we put on brackets, how it's all going to come together, right? We're like kind of comparing one tooth to the next. This one's at 2, so this one has to be at 2.5, 3. But we're not thinking about how the whole arch relates to each other, and then even more than that, how the upper and lower are going to relate in terms of their wire planes. It's almost impossible to do in an analog world, but using this technology, it's really, really beneficial to not only the efficiency of your planning, but the actual progress of the case. We've seen these cases are being more profitable because we're treating them in less visits. And at the end of the day, we've learned that we really can and should expect more from our braces. So let's take a look at our first case. This is a patient who presented in January 20th, 2020, okay? And he is a class 1 case, not a terribly difficult case, but some mild to moderate crowding. And, you know, one of the interesting things about mild to moderate crowding cases is that, you know, these are the kind of cases that we used to tell our patients, yeah, this should be done in about a year. But when you look back at the charts, you actually see that these cases take longer. Sometimes they end up being 18 months, 20 months, 24 months. And you look that you know, we don't appreciate how much work it is to compensate for the lack of planning in an analog appliance and the lack of customization. Once we have customization, suddenly I think we're able to not only promise the correct amount of time, but often get there a little bit sooner. So let's see how it plays out. So he was bonded in January, and we delivered the LightForce braces about 5 weeks later. That was the first visit, let's call it. We did an indirect bonding with an 020 slot, upper 014 copper niti, lower 013 copper niti, and you can see that the bite turbos have been bonded. How much time have I spent at this appointment? Probably a minute, checking flash, maybe, you know, saying hi to the mom, saying hi to the patient. Now, visit 2, of course, then, you know, COVID hit just 2 weeks later, so we didn't see him, but visit 2 was June 29th. So 4 months later. I don't have photos from that visit, but we immediately transitioned him to 18 square wires, 18 square heat activated niti, and we bonded the 7s at that visit, and we removed the bite turbos. And then he presented back on September 22nd for his 3rd visit. We placed upper and lower 1825 copper nitis. Remember, we're in an 020 slot, so it's a large wire in that slot, and we chained on the upper. And if you take a look here, the occlusion looks excellent. The case is well aligned. It looks pretty much exactly like the digital plan. And we've completed, you know, to date, even with COVID not allowing us to see the patient as frequently as we wanted to, we've achieved this result in 7 months. We have a little bit of space closure, and I think the case may be done by his next visit, which we scheduled, I believe, just to kind of knowing that he'll be done soon, maybe 6 or 8 weeks out. So we expect to finish this case in 9 months. One kind of interesting thing that this patient was on dental monitoring, and one interesting thing you can do in dental monitoring is actually do a little like a GIF, or is it a GIF? I never know, but a little movie that will show the patient's progress based on their sequential scans. And what I did here is I actually made I cut and paste the video from the light plan animation of what we expected, how we expected the teeth to move, and compared it to how the teeth actually move. So let's take a look at that.
Dr. Waldman, we can't hear you.
Sound. John P. or Mike, can you give me a heads up that my sound is working?
You're good now.
Okay, thank you.
If you want to go back, though, that would be good.
To which slide?
Maybe go back one slide.
To here?
Yes.
Yes. Okay, perfect. I'm not sure what happened there with my sound. Sorry about that. This is a case that came in. This is our second case. Patient came in January of 2020, just one day after the last patient, I guess, and had his IDB on March 4th, right before COVID, 020 slot, upper 016 copper, lower 013. And then we saw him for the first time as an emergency visit about 5-6 weeks later in April. This was during the COVID shutdown, saw him for a broken bracket, but used that opportunity to move him ahead. Again, always looking for those opportunities to activate the appliance and get the case moving. And we placed an 18 square on the upper and a lower 016 copper nighttime. We now fast forward to September 14th, 3 months later, and this is how he presents to the office. 1625 copper night ties were placed, and we chained upper 6 to 6. And you can kind of see from this, this is just visit 3, okay? So there was the bonding, we had a quick emergency wire change, and then we had his first kind of real adjustment. And I want you to just kind of take a quick peek at where the case started. He was bonded in March, and 6 months later, we have just a highly accurate expression of our treatment plan. Our bite is opening, the case is well aligned. It's not finished. We have a little space there in the upper we need to close still, maybe a little more work on the lower alignment. But to be 6 months into the case and to be this good, I think really shows you the efficiency and the accuracy of the digital system. And these are things that we're seeing over and over and over again. This is a young lady who presented farther back, March of 19, and she had a class 2. So we put her into a Carrier. By October of 2019, so about a year ago, she was in a overcorrected class 1. So we let it settle, and she presented again in December, and still has a slightly overcorrected class 2, but we're happy to start the case like that. And we started a LightForce case. One of the things that you'll note about her case is that she has this asymmetric canine torque. She actually had it also prior to the Carrier, but this negative torque that's distracting in the smile and is asymmetric. So if you kind of think of what, if you use an analog appliance that had negative torque on the canine or zero torque on the canine, you know, how would you really expect to get these canines into an aesthetically neutral position? It would be really, really hard. It would be really challenging. So it's an example of how sometimes our standard appliances, our standard prescriptions not only don't help, but they actually fight against our treatment goals. So you can see on the top, this is where she started. And at the bottom, you see the final proposed result in the LightForce plan. Look at the change of the canines and the overall alignment. There is actually something that I did wrong in this plan that I didn't catch. It comes back to bite me later. And I'm going to show you, but use this as an example of actually how accurate the bracket placement is. And if you don't get it right in the plan, you won't get it right in the mouth. So you do need to make sure that your light plan is accurate and you're really happy with it, because what you see is what you're going to get. This was her bonding in January of 2020. You can see there's a lot of activity there on the canines. There's a lot of tip and torque, not torque, but there's a lot of tip happening, a lot of vertical movements happening here. And here's where she is now in September 2020. And she had about 2 or 3 visits in between. I think she's on her 4th. I think this might be her 4th or 5th visit between January and September. But you can see how well aligned the case is. We have the space is closed. The case is not done. There's a little bit of movement still needs to happen in the upper. But again, just 8 months in, we're in a fantastic a place with this case. So here's the pan that we took to show you we have excellent root alignment. I wasn't happy with that lower left 4. It looked like we had a little bit of mesial root tips. I need to go back into my plan and see how was I not visualizing that correctly. Perhaps like on the plan, I had a little bit too much tip in there. But what you see is what you get. So you really need to look at that plan carefully and know how powerful it is. Let's take a look at where she is now. And what you'll notice when you compare to what we planned, you'll see that the canine torque is symmetric and much more positive. And I believe that that's a function of the customization of the appliance. And that would have been very, very difficult to achieve with a standard appliance. But you'll also see something that doesn't look so good. And hopefully you'll understand why. Now, if you take a look at the upper ones, number 8, number 9, you'll notice actually a slight incisal edge discrepancy on the top. And if you take a look at the lower image, you'll understand why. That actually, for some reason, I didn't see it. I was probably worrying about other things, but in my plan, I didn't actually perfectly level the incisal edges, and it gets expressed. So that's okay. We'll either rebond the bracket, or maybe we'll put a little wire bend in there to finish it. Not a big deal, but it really, from this, I learned a lot, and I learned how accurate this plan is and how important it is to make sure you start with the end in mind. This is one of our last cases. This is a young lady who I treated with a phase 1 when she was younger with a face mask. She had an underbite. And she came back for phase 2, still showing that class 3 tendency. You can see it in the profile. And also, you can see that the lower incisors are retrocline. She's got that kind of posterior open bite tendency. There's enough here to be a little bit cautious going into the phase 2. This was the setup of the brackets on the malocclusion. This is the setup, how the brackets express themselves in the final stage of the plan. And again, it's not like Invisalign, but there's multiple stages, just initial and final. And here's the final occlusal setup. But for the orthodontist in the audience, you'll know that to get from that initial photo that we showed to here, it's not so simple. There's going to be some mechanics involved. And one of the nice things about the LightForce plan is that you can actually use the animation to help to visualize what those movements are going to be. And so you can see here that we've got a lot of vertical movement of the canine and the bicuspids to help us close that down. And so what already from the planning, we can visualize the mechanics that we need and have in the chart or have in our mind that we're going to want to get into some elastics to help to close that down sooner than later. Okay, now this patient started her treatment on December 18th of 2019. At the time we were using the 022 slot. I believe probably the 020 wasn't quite yet available. And we put her in 013 copper nitrides. And I have to say, this was a little bit of a scary day for me because, you know, we had someone who has this open bite tendency, lateral open bite, class 3 kind of tendency. And in order to clear the brackets, we needed to put on bite turbos. And that opened her up even more. And we have this crowded lower arch, this lateral open bite. And we can all just look at these photos and imagine this case just completely opening up on us and really losing control of the occlusion. But it's really a testament to the LightForce wire plane planning and occlusal planning that this did not happen. Now, it happened to be because of COVID. I did not see this patient for 6 months. And she came in on May 26th for the first time, not wearing the elastics. This is the end of the visit photos, but she came in and this is what her occlusion looked like, May 26th. I had not seen her since December 18th. We let those 013 copper nitrides work throughout the COVID shutdown. When she came into May, which was 1 week exactly after we opened, this is what she looked like. We did not lose the occlusion anteriorly. We had some closure of the bite posteriorly, but not complete. So we started her on some kind of class 3 vertical box elastics and got her into 18 square wires to start to activate more of the prescription and got the 7s bonded. And then she came in 3 months later. We scheduled her 12 weeks out. She came in on August 20th, and this is what the occlusion looked like. We had it closed down, so we stopped the elastics. We placed new wires, and we activated a coil for the lower right 5. You can see that that was actually a slightly large bicuspid, which is why it was so blocked out. And kind of kicked myself for not starting the coil earlier in treatment because I would have been in a better place. But kind of quickly realized that we just didn't have enough space. So put a coil in, let go of the 5 for now, and we're going to pick it up once we have a little bit more space. But again, this is a little bit more of a complex case, more mechanics. And you can see that going from December of 2019 to August of 2020 in 2 visits and have this level of control of the occlusion, I think is a remarkable thing. This is the last case we'll look at. It's an interesting case because it was a transfer case. It's an adult patient who had just had 4 bicuspids extracted, had braces on for maybe 2 or 3 months, and then moved to LA. She works in the movie industry. And so we recognized that it was the correct treatment plan to take out the teeth. She was had a severe bimaxillary protrusion. But one of the things that I didn't like was the fact that her smile line. You know, she had this really curvy lower lip. I'm not even sure the true anatomical description of that. Very curved, kind of convex form of the lower lip. And the standard bracket application had been put on exactly as we've been taught. 2.5 millimeters up, 2 here, 2.5 here. But what that effectively did was flatten her smile line and put this very flat smile line into this very curved lip line. And it didn't match, and it was extremely apparent. So I suggested that we switch to LightForce so that we can get control over that smile line. Here's how she came in with the brackets on the left. And after I converted her, after 1 or 2 visits, here's how she looked on the right after we started some space closure. And you can already see a significant difference in the smile. On the left being very square, very pointy, and the right using the bracket system to guide the teeth into the appropriate smile line for her face and her aesthetics. And again, that's a virtue of the customization and being able to control the smile arc without affecting the torque of the brackets. You see how much nicer already the smile is looking just from that level of control. I hope this lecture has been helpful for those of you who are learning more about LightForce or looking to kind of expand your braces practice into the new digital realm. But for those of you who kind of still thinking about what you want to do with your practice, I will tell you, whatever you do something new, because we have this motto now in our practice, you know, hey, coronavirus, move over. We need something new in our practice. And we're really trying to move on from the limitations of the past and open up the possibilities of the future. And we've really found that by embracing LightForce, not only has it given us that customized solution and that digital workflow, but has really kind of got us excited about braces again. We're seeing a lot of, you know, clinical creativity and efficiencies, and just, you know, everyone needs these days a little bit of dose of inspiration and excitement. And I have to say that LightForce is you know, truly giving us that. And with that, I'll end. Thank you very much for those of you who have stuck in for the full amount of time, and I'll take any questions that we have.
Thank you, Dr. Waldman. Great presentation. I have some questions. Before I get to those, I'd like to invite viewers to use the question box in your control panel to ask any questions that you have. We are getting questions in, and the first one is, what about anchorage?
Okay, so I mean, anchorage is going to be very similar to any, you know, labial system you have. If you're going to be engaging more torque, you may need to think about your anchorage needs, whether you want to back up some mechanics with elastics or use TADs. But the beauty of LightForce is that you have to think about it as any other you know, labial system. So you don't really need to change your the way you think about braces or the way you think about treatment planning. You're just going to have a more highly accurate tool at your disposal.
Okay, next question. What app do you use to plan the case, and how do you print the braces? What I mean is, do you use an app like BSP, or do you have one of your own?
Okay, as we showed before, so LightForce, there's a website and you can check it out, LightForce Ortho. And once you become a doctor, you'll have, you know, access to the doctor portal, and you will actually plan all of your cases online through their cloud-based software on their website. So you're using the LightForce system. And printing, this is a highly industrialized process. I didn't get into the details. I don't really know the details, to be honest, but it's not something you print in your own office. They will print, fabricate, finish out all the brackets, place them in the indirect bonding trays, and of course, send them to you for bonding.
I think this is also, what kind of resin do you use?
For the bonding, I'm assuming, we used to use Transbond, and we now use LCR, which I was introduced to by Dr. Griffin, and we are loving it. The interesting thing about LightForce is you need very, very little material, because there's an intimate fit of the bracket onto the tooth. So if you have too much material, you're going to get a lot of excess when you do the IDB. So there's a certain art just to learn to put a tiny bit on and just the right amount. And you want a nice material that's going to flow into the custom base and get into the mechanical kind of interlocking system. And so the LCR from Reliance Orthodontics seems to do a very good job at that.
Okay, next question. What about the use of elastics?
Yes, so again, we will use elastics or any other appliance like we would. Just you know, don't change how you think about orthodontics. If the patient needs elastics, use elastics. We're going, and I kind of showed that in one of those cases. You know, we use a lot of Carrier now in our appliance to set up the class 2 correction up front, or a Mara appliance. We'll still do that, get that out of the way, and then when we're ready for the braces stage, we will use the LightForce braces, elastics as needed.
Is it difficult to implement this into your practice?
I would say that it's quite easy, actually. You know, in terms of the mechanics, it's really the same. And what I mean by mechanics is, you know, how you're moving teeth. Are you using elastic? What auxiliary appliances? Those are going to be the same. And so it's very easy for your assistants to look at it and say, okay, yeah, I got this. This is a bracket. We're going to tie it in. You know, if there's anything you need to learn, it's maybe how to do indirect bonding if you haven't done that before. but it's so easy with LightForce. They've made it so easy. It's so clean, and it's so the technical application of it is so efficient that it's very easy to learn, and the LightForce sales reps will work with you to teach you how to do it with best practices.
Do you have any more root resorption because the teeth are moving faster?
I have not seen it yet on the progress pans I've taken. And I don't think we're moving the teeth faster, by the way. I just think that we're, you know, the wires we're using are copper nitrile wires, heat activated wires. They're very soft, very gentle wires. The idea is that you're actually, you know, activating the prescription. It doesn't have to be an aggressive activation, but that you are filling the slot, even if it's very gently. With a very light and soft wire, you are getting that activation. Long term, I guess we'll have to have, you know, research studies to show, but short term, I don't see any differences or changes yet.
Okay. We have a lot of questions. How fast do you get the brackets back after you have approved the treatment plan?
For about the first year we were using LightForce, it was about, from the time you approved the plan. So typically the whole process from the time you scan, right, and submit to the time you get the brackets was about a month. That's how long we were scheduling patients out. During COVID, it changed, and not because LightForce got less efficient, but there was a lot of demand. People were finding out about it, and you know, they had to kind of accommodate a lot of new users. Slow down a little bit, and now we're back on track. And we're scheduling, you know, 4 to 5 weeks out.
What is the difference between your Clin check process and your light plan review process?
That's a great question. My Clin check, you know, I have a system that we use for Invisalign treatment planning. It's actually a course that I now teach. You can check out tapsortho.com, and it's we have a whole system. And we've trained assistants in our office to assist me, and we really have it down, but we incorporate staff into that system for a high level of efficiency. For LightForce, I have not found that that's necessary. And when I get the email that we have a case ready to check, I just go in and log in on my Chrome, takes me right there from the email into the case, and I look at it, make an edit or two, or approve it. But it doesn't take me more than 2-3 minutes. So those I just do myself, and I find it to be a very efficient process.
How do you communicate the value and sell this to your patients?
Well, I think that the value to a certain extent speaks for itself. I like to focus on the concept of customization. And I tell them that, these days, although we have a lot of braces, the braces I recommend are LightForce. The reason is because this is the only braces that gives me a custom solution. That is to say, I know this sounds surprising. I say this to the patient. I know it sounds surprising to you, but did you know that all the metal braces that you see out there are all the same? And it doesn't matter what type of bite you had, what type of malocclusion you had, whether you had crowding or spacing, open bite or closed bite. They don't know what these things mean, but they understand that they're different. No matter what you started with, we were using the same brace, exactly the same. And that doesn't really make sense. It's just what we had. But now we have the ability to create a specific set of braces to treat you or your child or whatever it is. And the reason we're able to do that is because of the advance in technology that we have with 3D printing and digital planning. And we'll have to see you for fewer visits. Your treatment will be faster, and we expect a better result. And for those reasons, I recommend LightForce, and that's my value statement.
Okay, I have one more question, and then I think our time is up. Have you changed your wire sequence in your LightForce cases?
I'm not sure if the question is asking whether I changed it from my other braces to this or over time within LightForce. I'll speak to the first. With regard to it, yeah, I have actually. I think that prior to this, we used to spend more time in round wire, and then we're a little bit more conservative getting up into the rectangular wire, again, not knowing how that generic prescription will work out for that individual patient. So we don't want to activate the prescription too much because you might not like what you see. You might get some weird things happening. So with LightForce, we have the confidence to get into those third order wires earlier. So we are, our kind of transition was that we just get into a square wire earlier, like hopefully by the first time they're back, essentially, sometimes by the second time they're back, if we're still unraveling things a bit. So that's been a big change. And then often starting some elastics, you know, at that time, once we have that third order control, we feel confident that we can start the elastics without causing any tipping, etc. So the whole case kind of pushes forward a little bit as a result of that level of thinking.
Okay, thank you everyone for your questions, but we've run out of time today. If you did send in a question about the cost, please go to LightForce website and you will get information about for a demo and for the cost. If we did not get to your question, we will answer it after the webinar via email. Please be sure to take the free CE quiz associated with this webinar to get your certificate. Shortly, we will send you a recording of this presentation and instructions on how to access the CE quiz. I want to thank you all for attending and for your wonderful questions. And I want to give a special thank you to Dr. Waldman for an amazing presentation and to our sponsor for this webinar, LightForce Orthodontics. Thank you to everyone and have a good evening.
Thank you for listening.